this is, in fact, as Congressman Magaziner says, a crisis point. That's why we are speaking with such urgency. That's why we want Rhode Islanders to understand the efforts that we're taking up and the work that needs to be done in Washington to avert this very crisis. Because right now, for so many Rhode Islanders, the cost of living is just too high. Rent is expensive. Grocery prices are up more than 30% since before the pandemic. Energy costs are through the roof. And Donald Trump and congressional Republicans are trying to break our healthcare system and make it infinitely more expensive for Rhode Islanders. And so, you know, the attacks from the Trump administration and Republicans on our healthcare system have been vast. As you heard Congressman Magaziner say, from their big ugly law to their refusal to extend support for these enhanced premium tax credits, this undermines people's fundamental right to have health care. And so the choices are stark. Many Rhode Islanders are going to sit around their kitchen tables and have to make impossible decisions. Pay the rent or pay sky-high premiums. Put food on the table or pay sky-high premiums. Buy new school shoes for their kids or pay sky-high premiums. Get the car fixed or pay sky-high premiums. Pay sky-high premiums or not get the health care you need. So, you know, I said it before and I'll say it again. Trump and congressional Republicans are hell-bent on making Americans sicker, poorer, and way further from the American dream. They're threatening the health of more than 40,000 Rhode Islanders. And so without action, as Congressman Magaziner said, you can see premium increases double, jumping by a minimum 85%. For some people, we're going to see 200% to 300% increases. And these impacts won't be contained just to individuals. They're going to hurt providers, going to hurt community healthcare clinics, and this ultimately will leave us worse off. It will upend Rhode Island's healthcare system. And this attack, like I said, isn't happening in a vacuum. This summer, they passed the big ugly law. And the refusal to address this problem is leading our country towards a Republican-created shutdown. Full stop. Healthcare isn't a luxury. It's a human right. And so we're united in this effort. We're going to be back down in Washington fighting tooth and nail, trying to get bipartisan agreement. This should not be an issue that divides us in this country. So I am grateful to be on this team with these leaders, and we know that there's more fight to come out of us to make sure that every Rhode Islander has the health care that they deserve. Thank you.
Good afternoon, everybody. We are here today because the healthcare system is in crisis. It's in crisis in Rhode Island and all across the country. Here in Rhode Island, people who get their insurance through their employer are going to see their costs go up 15 to 20% next year, and in some cases more. People who get their insurance from HealthSource, RI, could see their health insurance costs double. And tens of thousands of Rhode Islanders are going to lose their health insurance. Why is this happening? Well, it's simple. It is happening because Republicans in Washington, led by the Trump administration, are cutting billions of dollars from the healthcare system. Over the summer, they forced through a partisan bill that will take $1 trillion out of the American healthcare system and drop 15 million people from their insurance. Now, they are threatening to shut down the government over letting the Affordable Care Act tax premiums expire, which would take billions of dollars more out of the healthcare system and cost more Americans their insurance. And here's the thing, everyone is impacted by this, because when you drop millions of people from their health insurance, as Donald Trump and the Republicans are doing, then that means less revenue for hospitals, less revenue for doctors' practices, less revenue for nursing homes. And they are faced with a choice, either go out of business or make up the revenue by raising prices on everybody else. And that's what we're seeing. What we are seeing is that the increased health insurance premium costs that have been announced for next year, the bulk of those increases are directly related to the expiration of the Affordable Care Act tax premiums and the cuts to Medicaid. That is what is driving this. This is a decision that people in Washington are making that are going to cause healthcare costs in Rhode Island to skyrocket, and we have to do something about it. The situation has reached a crisis point, and it requires action now. Not later in the year, not next year, not some other time in the future, but now. Congress is working on a budget for the next year. And on the Democratic side, we are united in our belief that this budget must address the healthcare crisis. It must extend the Affordable Care Act tax premiums. It must restore funding for Medicaid, restore funding for medical research, including cancer research, research that's being done here in Rhode Island. We have to address this crisis now, because if we don't, it will be too late. People are already making their decisions about coverage. People are already making their decisions about pricing. We have to deal with it now. And so we are gathering here today to call attention to the urgency of the situation and our commitment to dealing with it now. As I mentioned earlier, in that Democratic side of the aisle, we are united on this. And particularly the Rhode Island congressional delegation is united in our belief that the budget that Congress is considering now has to include a healthcare fix, because Rhode Islanders cannot afford soaring healthcare costs anymore. And I have a great partner in the Rhode Island delegation to the House that I know is just as committed to addressing this crisis with urgency as I am and as we all are. And so I'd like to have my colleague Gabe Ombel come up and share a few words as well. Gabe.
Thank you, Seth. And thank you, Congressman Magaziner, for your leadership in assembling us here. Thank you to the team at CCAP. And thank you to all of the healthcare leaders who are present. This is, in fact, as Congressman Magaziner says, a crisis point. That's why we are speaking with such urgency. That's why we want Rhode Islanders to understand the efforts that we're taking up and the work that needs to be done in Washington to avert this very crisis. Because right now, for so many Rhode Islanders, the cost of living is just too high. Rent is expensive. Grocery prices are up more than 30% since before the pandemic. Energy costs are through the roof. And Donald Trump and congressional Republicans are trying to break our healthcare system and make it infinitely more expensive for Rhode Islanders. And so, you know, the attacks from the Trump administration and Republicans on our healthcare system have been vast. As you heard Congressman Magaziner say, from their big ugly law to their refusal to extend support for these enhanced premium tax credits, this undermines people's fundamental right to have health care. And so the choices are stark. Many Rhode Islanders are going to sit around their kitchen tables and have to make impossible decisions. Pay the rent or pay sky-high premiums. Put food on the table or pay sky-high premiums. Buy new school shoes for their kids or pay sky-high premiums. Get the car fixed or pay sky-high premiums. Pay sky-high premiums or not get the health care you need. So, you know, I said it before and I'll say it again. Trump and congressional Republicans are hell-bent on making Americans sicker, poorer, and way further from the American dream. They're threatening the health of more than 40,000 Rhode Islanders. And so without action, as Congressman Magaziner said, you can see premium increases double, jumping by a minimum 85%. For some people, we're going to see 200% to 300% increases. And these impacts won't be contained just to individuals. They're going to hurt providers, going to hurt community healthcare clinics, and this ultimately will leave us worse off. It will upend Rhode Island's healthcare system. And this attack, like I said, isn't happening in a vacuum. This summer, they passed the Big Ugly Law. And the refusal to address this problem is leading our country towards a Republican-created shutdown. Full stop. Healthcare isn't a luxury. It's a human right. And so we're united in this effort. We're going to be back down in Washington fighting tooth and nail, trying to get bipartisan agreement. This should not be an issue that divides us in this country. So I am grateful to be on this team with these leaders, and we know that there's more fight to come out of us to make sure that every Rhode Islander has the health care that they deserve. Thank you.
Well, thank you, Gabe. I think that was very well said. Again, Rhode Islanders are burdened by high costs across the board, including the cost of health care. They cannot afford to pay significantly more on their health insurance costs next year for a problem that is entirely preventable and unnecessary, and that we can solve and we must solve. To bring some expert explanation to what is about to happen and what the cost of inaction would be, I'd like to invite up Lindsay Lang, the Director of Health Source RI.
Thank you. Lindsay Lang with Health Source RI. Thank you for representing our state on this issue and bringing attention to it on behalf of Health Source RI customers and marketplace customers all around the country. We find ourselves at a real inflection point this fall. For over a decade, Health Source RI has served as the state's marketplace for high quality, affordable health coverage for those who don't have it through another source, like their employer or the Medicaid program. The enhanced tax credits are what have made health coverage so accessible in recent years. In fact, our enrollment through Health Source RI has increased over 50% in the last couple of years that the enhanced tax credits have been available. This growth is driven by and coincides with the expansion of the federal tax credit available to marketplace customers. And our customers use that every single month to bring down their cost and stay connected to health coverage so that they can get the services they need. Over 47,000 Rhode Islanders are covered through Health Source RI, and 90% of them are receiving a tax credit subsidy for care right now. And they use that enhanced portion of the tax credit to buy a great plan and make their household budget work while remaining connected to coverage. The expiration of the tax credit, which will happen at the end of December of this year, is projected to cause as many as 13,000 Health Source RI customers to lose coverage because of affordability issues. It's the same people who have used the enhanced tax credit these last 4 years who are most vulnerable to losing health coverage starting on January 1st. Next month, we will send out our open enrollment notices and our customers will begin to shop for 2026 coverage. And when they go to renew, they're going to see premium costs go up over 100% on average. That's about $111 per person per month. For middle income Rhode Islanders making about $60,000 for an individual, $120,000 for a family of 4, they'll see an average of $631 increased each and every month. And this group is going to see the highest dollar increase out of anyone on the marketplace. We also know that this cohort includes our older Rhode Islanders. Our most vulnerable Rhode Islanders, or customers, folks who are making just a little bit too much to qualify for Medicaid but still under $37,000 a year, are going to see the highest percentage increase when you compare 25 to 26. They'll see increases of 200 to 300% every month. While the enhanced tax credits have been in place, we know through our health insurance survey that the number of uninsured individuals in low-income households has decreased by 63% from 2020 to 2024. To be clear, these are average working families working to support their families and stretch their budgets to ensure they have the health insurance it takes to get the medical and mental health care services they need. When thousands and thousands of Rhode Islanders lose coverage due to increased cost, we'll see the effects in our schools, our workplaces, and our emergency departments. We'll also see fewer federal dollars flowing into the state. The enhanced portion alone is worth $60 million. That's off the table starting January 1st. There's also the folks who will lose coverage because of affordability, and when they go, so too will the federal dollars that come in to help support their coverage on the individual market. That's another $70 million that will no longer be coming into our state. The total effect could be up to $130 million a year in overall reduced federal funding for Rhode Islanders' individual insurance market, of which 80% is usually passed through to our providers. Losses of this magnitude will be coupled with a dramatic reversal in the 54% decrease in uncompensated care Rhode Islanders have seen since the implementation of the Affordable Care Act, burdening hospitals and other providers as uninsured Rhode Islanders will be unable to pay for their care. Lacking health insurance can destabilize families and households. When unexpected health care costs are incurred and badly needed care is postponed, people suffer and their financial stability is put at risk. Postponed care can lead to worse medical and mental health outcomes, higher bills for more acute needs, and individuals who are left digging out from tough financial situations for years due to one bad turn. Access to proper health care supports so many other things in life. Our ability to learn, to work, to raise a family, to help our communities. Protecting Rhode Islanders' ability to seek the mental and physical health care services that they need to lead healthy and productive lives is core to our mission at HealthSource RI and to the future of our state. And we urge that these enhanced tax credits remain available for the benefit of our customers and the future of Rhode Islanders' healthcare system. Thank you.
Thank you, Lindsay. One of the things that people at home need to understand is that these Republican cuts to healthcare are going to drive up costs for everybody, regardless of what kind of insurance you have. So even if you're not on Medicaid, even if you're not on HealthSource, it has already been announced that your prices are going to go up significantly next year because of these Republican cuts to healthcare. And so to give a little more color to that, I'd like to invite up Pete Marino, the CEO of Neighborhood Health Plan of Rhode Island.
Good afternoon. I'm Pete Marino, the CEO of Neighborhood Health Plan of Rhode Island. I really would like to take first the opportunity to thank our delegation. We have a terrific delegation, and they are what I would describe as healthcare champions, and we're very fortunate to have them here in Rhode Island. I would also like to thank Chris Mansfield and CCAP for hosting this press conference today. CCAP is a great partner in the community, and we're very fortunate to have them. As you know, Neighborhood is the largest health insurer for folks who are low-income Rhode Islanders in the state through its Medicaid program, its Medicaid Medicare program, and our commercial programs. Nearly 90% of those choosing Neighborhood commercial health plans in the exchange receive premium tax credits. So when you get a sense of the size and scope, you can see what kind of impact that's going to have. The exchange is there to really expand access to health care, to expand access to health insurance for all Rhode Islanders. And the federal premium tax credit program ensures that health coverage is affordable and within reach of all of us. Tens of thousands of Rhode Islanders will directly feel the impact of the expiration of the enhanced tax credits. Some will experience increases in the hundreds of dollars a month, just as Lindsay Lang just told us a little bit about. This is not sustainable for many of our friends and neighbors who depend on this coverage. Medicaid and the exchange work hand in hand, something that was alluded to earlier in this discussion. Folks who have coverage oftentimes find themselves working between both Medicaid and the exchange over their needs for health insurance. So it's also really important to note that due to the federal changes to Medicaid, as was noted earlier by our two congressmen, folks will have a much more difficult time securing and affording insurance on the exchange. So Neighborhood urges Congress to clear a pathway forward. They need to prevent the expiration of the enhanced tax credits, to protect and ensure that the millions of Americans that are going to be impacted and the thousands of Rhode Islanders who will be impacted are able to afford meaningful health insurance here in Rhode Island. So we appreciate it. The last point I will make is that oftentimes the most difficult things to recover from are self-inflicted wounds. And as the Congressman talked about, this Congress and this President are creating a self-inflicted wound on the health insurance industry in this country. They're the hardest to recover from, so let's not do that. There's an opportunity to make a choice here. So we're looking forward to the work that our congressmen are going to do, and for all of us to be behind them to make sure that they can be successful. Thank you.
Healthcare providers in Rhode Island are already under significant stress for a number of reasons, and this Republican assault on healthcare in Washington is going to make it even harder for many healthcare providers in Rhode Island to stay in business. So to speak on that, I'd like to bring up our new-ish president of the Hospital Association of Rhode Island, Michael Straczynski. Michael.
Thank you. Good afternoon, everyone. On behalf of the hospitals and health systems across Rhode Island, thank you to Congressman Magaziner and Congressman Amo for bringing us together today. We appreciate your leadership and all of the work you're doing to protect healthcare for Rhode Islanders. The coalition up here today shows that in this state, we do healthcare together, from frontline workers to hospital leadership to our public officials and policymakers. But as strong as we are locally, what happens in Washington, D.C. has an enormous impact on how our system operates. This is certainly the case when it comes to essential supports like enhanced premium tax credits. These tax credits don't just help keep patients healthy, they help keep hospital services sustainable. I want to echo much of what has already been said today about what the loss of these credits would mean for people across the country and in our communities. At a patient level, at a hospital level, at a state level, is cause for great concern. It is already difficult enough being a patient these days. We know that families across the state are facing difficult choices when it comes to their health care, especially when it comes to how they access it and how they can afford it. For the tens of thousands of Rhode Islanders who rely on these tax credits to be able to afford insurance, a significant increase in premiums would make comprehensive health care nearly impossible. The impact of this resource going away is clear. Healthcare would become less affordable and less secure for millions of Americans and thousands of Rhode Islanders. The massive ripple effect this would have on hospitals and caregivers is also clear. People don't stop needing care when they lose health coverage. Instead, care is delayed, people become sicker, and when they do end up in the hospital, their needs are more serious, more strenuous for frontline workers to treat, and often more expensive. Uncompensated care goes up, hospitals absorb unsustainable losses and are faced with difficult decisions about how they can continue providing care services in the local communities. And then costs eventually rise for everyone. For years, hospitals, healthcare workers, and patients have been warning about the fragility and instability of Rhode Island's healthcare delivery system. The Medicaid cuts passed at the federal level earlier this year greatly compound these challenges. Allowing the enhanced premium tax credits to expire now would only accelerate Rhode Island's healthcare crisis, with hospitals, caregivers, and patients paying the price. That is not the type of healthcare system Rhode Island wants or deserves. At a time when families and providers are already stretched thin, we cannot afford to take away this resource that makes coverage possible for so many people. That is why the hospital community is joining the call to preserve these critical tax credits so that tens of thousands of Rhode Islanders can afford the care they need, when they need it, and healthcare providers can continue delivering these services on a daily basis. Thank you.
And finally, another important constituency that will be impacted by these healthcare cuts if we do not act to reverse them is Rhode Island's healthcare workforce. The healthcare workers of Rhode Island have been through a lot over the last several years. Their already challenging jobs were made more difficult by the pandemic, by workforce shortages, by inflation, and now are being threatened once again by these Republican cuts. And so to speak for healthcare workers in Rhode Island, I'd like to invite up Lynn Blaze from the United Nurses and Allied Professionals.
Good afternoon. My name is Lynn Blaze. I represent over 7,000 Rhode Islanders at United Nurses and Allied Professionals. I've also worked as a registered nurse for the last 41 years, currently as a recovery room nurse at Our Lady of Fatima Hospital. I have seen the good, the bad, and the ugly of healthcare in Rhode Island over those 41 years. I must tell you, Rhode Island's healthcare system is on the verge of collapse and cannot take one more negative blow without the risk of the system completely imploding. We currently have 2 of our community hospitals in bankruptcy and could be closed at any time. If we don't do something to prevent the cuts to the tax credits and prevent the cuts to Medicare, that will be the final blow for Rhode Island's healthcare system. We will be returning to a time when thousands of Rhode Islanders didn't have health insurance. Hospital emergency rooms will be bursting. Rhode Island won't have primary care doctors or clinics. Rhode Island won't receive preventative care. Those Rhode Islanders will now seek treatment at our local hospitals. This care will be at the highest of cost and provided to Rhode Island without health insurance and no ability to pay. This uncompensated care will be the final blow to the Rhode Island healthcare system. This will ensure physician practices and clinics will close, hospitals will either close or drastically cut certain services and programs, jobs will be lost, and Rhode Islanders will die. So I thank Congressman Magaziner, Congressman Amo for their continued fight for all Rhode Islanders for trying to protect our healthcare service. Thank you.
I'll invite Congressman Amo up for any closing statements before we take questions, but I'll just say this. Rhode Islanders are already struggling with high costs from tariffs, high costs from the assault on clean energy coming from the Trump administration, and now Rhode Islanders cannot afford double-digit or triple-digit price increases on their health insurance next year. Cannot afford it. But this is a solvable problem. All we need to do is restore Medicaid funding, extend the ACA tax credits, restore funding for public health, and we can at least stabilize the system for the years to come. Now, we want to vote for a federal budget that is bipartisan and can help deliver a stronger economy for the American people, but it has to include a fix to this healthcare crisis, because if we wait even weeks or months to deal with it, it will be too late. And a lot of these higher costs will be baked in and people will not have been able to re-enroll in their insurance. So we have to deal with it now. And it is beyond disappointing that President Trump canceled a meeting that was scheduled with Leader Jeffries and Senate Democratic Leader Schumer to talk about addressing the healthcare crisis in the budget. Canceled the meeting, wouldn't even take it. And now Speaker Johnson has canceled the House session for next week in an attempt to rush through a partisan budget that fails to address this healthcare system crisis. We are going back to Washington next week because we are committed to dealing with this and dealing with this now, and we hope that the Speaker will call back the House Republicans as well so that we can deal with this in a bipartisan manner, pass a budget that deals with this healthcare crisis so that Rhode Islanders don't get forced to pick up these huge cost increases next year. And finally, before I call Gabe up for any closing remarks, big thank you to CCAP for hosting us. Speaking about healthcare providers, a tremendous provider right here in the city of Cranston, led by Chris Mansfield. I want to thank you all for having us here today and for all the work that you do to make Rhode Islanders healthy. And we are here to fight for you and to fight for your patients and to make sure that all Rhode Islanders have access to affordable, high-quality health care. So Gabe, do you have any?
Yeah. I'll say briefly, one, Congressman Magaziner has it exactly right. It does not have to be this way. And this is not an imminent threat. This is a present crisis, a present circumstance. In a few weeks, Director Lang is going to have to send out communication. You've already seen this occur from our health insurers. This is here. Open enrollment period is weeks away. And so there is an urgency to this matter. The enhanced premium tax credits, coupled with a restoration of the idiotic cuts to Medicaid, has to be the next step. one, to protect Rhode Islanders as individuals, but two, to protect the system, and you heard the voices of that system. So we stand alongside our senators. We are in this together. We are going to keep fighting. Rhode Islanders deserve affordable, accessible health care, and we're going to do everything to make sure that's the case. Thank you again to Congressman Magaziner for organizing this and all of our leaders for being here.
Questions?
Director Lang, is it possible, is there a legal mechanism to adjust the timing of the enrollment period?
So I presume you're asking in case there is action but late breaking on the enhanced tax credits. That is something that we're thinking about and planning for, certainly hoping for. And to the extent that that occurs, yes, we will have some flexibility to extend the opportunity for customers to come back in, review their options, get support in comparing prices, and pick a plan that works for them. We definitely have that flexibility.
Congressman Magaziner, is there, and I know this is mathematically probably a Herculean task, but has there been an attempt to calculate the financial impact of non-paid for services at hospitals that might occur, and possibly in an explosive manner, after the expiration of these tax credits?
Like on a Rhode Island
Yeah.
state-specific basis? I think it's hard to say. I mean, again, like the number I keep coming back to is just at the high level, right? Like we know that the Medicaid cuts alone are gonna take $1 trillion out of the healthcare system over the next few years. The expiration of the ACA tax credits is hundreds of billions more. So like in aggregate, the idea that you could take all of that funding out of the healthcare system and not have catastrophic consequences is of course, completely unrealistic. And you're already seeing it. I mean, again, talk to the insurers, right? Like talk to United or Blue Cross or the commercial insurers that just announced their double-digit premium increases. They will tell you that the primary driver of those increases is the expiration of the ACA tax credits. And obviously, for those who get their insurance through HealthSource, those increases are gonna be even higher. So like, we know what the impact on Rhode Islanders is gonna be, and it's gonna be significant if we don't act, but there's still time.
And speaking of impact, we've seen what feels like almost a perfect storm of crises. We've got utility rates skyrocketing, we've got this healthcare crisis, primary care facilities closing down, hospitals closing down in the past 20 years, and a housing shortage. Everything just seems to be congealing to be this terrible thing. I think, Lynn, you put it bluntly, Rhode Islanders will suffer and Rhode Islanders will die.
Absolutely.
What can we do?
Well, look, this is why we are raising the alarm. Seth and myself have been fixated on the cost of living crisis that Rhode Islanders have been experiencing. That's why we focus so intensely on the energy crisis and the self-inflicted wound of the Trump administration going after our ability to get clean, cheap energy. That's why we are working so hard on healthcare, knowing that it's the biggest driver for many households. The fact of the matter is these idiotic tariffs, again, present a situation where you have everybody from small manufacturer to household going to the grocery store and trying to get essentials. And so, to your point, it is a perfect storm of challenges for the people of Rhode Island. That's why we have to fight even harder. That's why we have to be very focused that a lot of the actions that we've seen from the Trump administration have been about supporting those who don't need the help, the top 1%, the largest corporations. It is antithetical to the values that we have in this country, and it's an essential fight that we will keep waging.
Do you have,
Go ahead.
no, I'm sorry, you're gonna answer.
No, go ahead. Sorry.
How you doing? Do you have any sense of how much time you have? I mean, we're about to start the last month of the federal fiscal year.
Yeah.
Do you get a sense that they're really gonna push fast, or do you have time to try and
I'll let
build a
anyone else weigh in
consensus?
who wants to, but let me just address both things. So on the first question, look, it's like the Trump administration and Republicans in Washington are trying to do everything they can to make life more expensive for Rhode Islanders, right? They're making food at the grocery store more expensive with tariffs. They're making energy more expensive by trying to block Revolution Wind. And now they're trying to make healthcare more expensive by letting these tax credits expire and by cutting Medicaid. At a certain point, the average working person just can't take it anymore with the price increases, right? And that's why we have to act. And to your point about timing, or your question about timing, one of the things that I've been hearing that we're concerned about is, even if this were dealt with later, when people go online to enroll in the next few weeks and they see the sticker shock of double-digit or triple-digit premium increases, they're going to elect not to get insurance at all, and they may not enroll later. Or they will elect a lower cost plan that doesn't have the same breadth of coverage, which is not only bad for those individuals, but also, again, bad for the system because less is being covered. So that's why timing matters. And we feel the urgency here because of that, because we know the longer it takes to have a fix, the worse it's going to be for our already strained healthcare system. But also, sorry, like, when I see Mike Johnson and other Republican leaders say, oh, well, pass a short-term budget and we'll deal with the healthcare thing later, sorry, they have no credibility, right? We're supposed to trust that the people who just cut $1 trillion from Medicaid are going to deal with this later? No way. So I invite anyone else to weigh in.
I know it's a little out of your purview, but at a more local level, should this come to pass as is and things don't go the way that you're fighting to have them go, what can we do as a state? Like what recompense do we have from the health source side, from the insurer side, from the hospital side? Like, how do we mitigate this should it come to pass as is?
Well, I can say quite simply that there's virtually no way for the state to be able to replace something of this magnitude. $60 million is the value of the enhanced tax credit. 130 is our estimate in terms of what's coming off the table due to the enhanced tax credits expiring and folks going uninsured. I would mention one thing that is coming this fall at the end of October. The Secretary of the OHHS, at the request of the General Assembly, has pulled together stakeholders from across the payer and provider and consumer industries, as well as my colleagues in state government, to start identifying and wrapping our hands around the impact to each of those constituencies, trying to define the fiscal impact to the state and identify solutions. But again, quite simply, we cannot replace the full value, and people will go uninsured and people will suffer because this help is not there.
I guess 2 points are important on that question. One is that I think where Congressman Ahmed was going when he opened up his conversation was people are going to have to make some very difficult choices. Some of the hardest choices that families are going to have to make are about, am I going to have food for my family this week, or am I covering my health care? Am I going to delay bringing my child into a hospital because I don't have insurance? That kind of anxiety and disruption is already festering in our communities, and we need to find ways to alleviate that. The plus side is that Rhode Island has always demonstrated the kind of resiliency in these kinds of circumstances in the past. We've gone through difficult economic times in the past. We have great organizations throughout the state, such as CCAP and others at Neighborhood, that will be there to do what we can to support folks. But at the end of the day, this is an opportunity to make sure we don't have to create a problem that doesn't have to exist. And so our great congressmen here behind me are doing whatever they need to do, but they need all of us to make sure that we're calling families and friends in other states so they reach out to their congressmen, their senators, to say, this is unacceptable, and we need to make sure that that happens, or otherwise we'll all suffer together.
Congressman, on a more optimistic note, Congress recently passed legislation that would dramatically impact certain key pharmaceutical prices, insulin amongst them. How has that gone? Are there any specific numbers coming out of that in tax savings? Is that program going to expand?
Yeah, I mean, I think there are a couple of things. You're talking about the Inflation Reduction Act passed by President Biden and congressional Democrats 2 Congresses ago. And yeah, I mean, capping the cost of insulin has been I think, wildly popular and wildly successful. And then allowing Medicare to begin negotiating with the drug companies to lower the cost of prescriptions for Medicare enrollees has also had some initial success. Now, under the law, the negotiations happen in stages, so lower prices for the first 10 prescriptions that cover, I think, about 15 or so million Americans were announced about a year ago, and those lower prices are still in effect and are saving people lots of money. But under the law, there's supposed to be now a few additional rounds over the next several years with the drug companies to negotiate lower prices for other drugs. And I think it remains to be seen whether the Trump administration will follow that law or not. So we'll see.
Thank you.
All right, thank you all very much. Appreciate it. All right, thank you guys.
Thank you.